Hey guys, tonight we are stepping into the dimly lit, herbal-scented world of the medieval barber-surgeon. We are going to explore the sharp, metallic, and often terrifying reality of medicine before anesthesia. So, before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. Now, dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. You are standing on a narrow cobblestone street in the heart of medieval London. The year is 1347, and the world around you smells of wet stone, horse manure, and the faint metallic tang of the nearby Thames. The buildings lean inward above you, their timber frames dark with age and weather, creating a tunnel of shadow even at midday. The street is barely wide enough for two carts to pass, and the mud between the stones is thick and black, studded with things you choose not to examine too closely. Somewhere nearby, a woman is singing as she scrubs linens in a wooden bucket. The sound carries through the damp air, mixing with the clatter of a blacksmith's hammer 3 doors down. And then you see it, the pole. It rises from a bracket beside a doorway, spinning slowly in the light breeze. Red and white stripes spiral upward in a pattern that catches your eye and holds it. The paint is fresh enough to gleam wetly in the filtered sunlight, brighter than anything else on this grey street. The red is the color of fresh blood, vivid and unmistakable. The white is clean, almost clinical, like freshly boiled linen. Later, much later, this pole will symbolize something cheerful, something associated with peppermint and haircuts and Sunday mornings. But here, now, in the 14th century, it means something else entirely. The red represents blood, the white represents bandages, and the pole itself represents the staff that patients would grip, white-knuckled and trembling, while their blood was let. You step closer to the door beneath the pole. The wood is thick and studded with iron nails arranged in a decorative pattern. There is a small window beside it, and through the cloudy glass, you can see the flicker of candlelight. Above the door, a sign hangs from an iron bracket. The painted letters are simple and direct. They read, Barber-Surgeon, both words given equal weight, both services offered with equal confidence. The door opens with a long creak that seems too loud for the quiet street. You duck your head beneath the low frame and step inside, and immediately the world changes. The shop is surprisingly orderly. While the street outside is chaos and filth and medieval entropy, this space has been organized with almost obsessive care. The floor is swept. The walls are whitewashed. There are shelves along one wall, and on these shelves, glass bottles catch the candlelight and throw it back in amber and green and deep red. Each bottle is labeled in careful Latin script, tinctura, unguentum, extractum. The words mean nothing to you, but they sound important, sound medicinal, sound like they were chosen to inspire confidence in frightened patients. You notice the smell next. It is complex, layered, not entirely unpleasant, but definitely not familiar. There is vinegar, sharp and clean, used to wipe down the tools and the table. There is dried sage, bundles of it hanging from the low ceiling beams, mixed with other herbs you cannot name. Rosemary, perhaps, something darker and more bitter. Wormwood, maybe, or rue. And underneath it all, barely perceptible but definitely present, is the metallic smell of blood. Old blood dried into the cracks of the floorboards. New blood, still damp in the wooden bowl on the table. Blood that has soaked into the leather apron hanging on the wall. This is a place where blood is spilled regularly, professionally, therapeutically. The light comes from candles and from a window at the back of the shop, and it is the kind of light that seems to move, seems to breathe, casting soft shadows that shift as the candle flames flicker. Everything has a golden edge to it, a warm glow that makes the space feel almost cozy despite its purpose. The ceiling is low, barely 6 feet high, and the beams are dark with age and smoke. From one beam hangs a birdcage, and inside the cage, a small finch hops from perch to perch, chirping softly. The sound is incongruous, almost cheerful, a small bright note in a room dedicated to pain management. And there, in the center of the room, standing beside a heavy wooden chair, is the barber-surgeon himself. He is not what you expected. In your mind, perhaps you imagine someone old, someone grim and serious, someone who looks like an executioner. But this man is young, maybe 30, with clear eyes and steady hands, and a face that suggests competence rather than cruelty. He wears a long tunic of good wool, dyed a deep blue that indicates some wealth, some status. Over this he wears a leather apron, and this apron tells a different story. It is stained dark in places, lighter in others where he has tried to scrub it clean. There are splash marks across the front, patterns of arterial spray that have been partially washed away but never entirely removed. He looks up as you enter, and his expression is neither welcoming nor unwelcoming. It is professional, neutral, the expression of someone who has seen everything, who has held screaming men down while sawing through infected limbs, who has pulled rotting teeth from sobbing children, who has let blood from nobles and peasants alike. His hands are clean, you notice, scrubbed pink and raw. This is a man who believes in cleanliness, even if he does not know why it matters, even if the theory of germs is still 500 years away. He gestures to the chair, and you understand that this is where it happens, where all of it happens. The haircuts and the amputations, the shaves and the skull drillings, the tooth extractions and the cyst removals. This chair has held countless bodies, and if you look closely at the arms, you can see the marks where fingernails have dug into the wood, deep gouges left by people in unimaginable pain. Behind him, you notice the table for the first time, and your breath catches. The tools are arranged with the same obsessive neatness as everything else in the shop. They lie on a piece of clean linen, arranged by size, by function, by some logic that makes sense to the barber-surgeon, but seems almost arbitrary to you. The metal gleams in the candlelight, and each piece looks sharp enough to split a hair, sharp enough to part skin like water. There are knives, not one knife, but many. Small knives with delicate blades for precision work, larger knives with curved blades for cutting through muscle, heavy knives with thick spines for chopping through bone. The handles are made of wood or bone or horn, worn smooth by countless hands. Some of the handles are stained dark, and you realize this is blood that has soaked into the porous material, blood that cannot be washed away no matter how many times the tools are cleaned. There are saws, not the kind of saws you use for carpentry, although they are not so different. These are smaller, more refined, with teeth that are sharper and closer together. One saw has a curved blade designed to fit around a limb. Another is straight, meant for cutting through the skull. The teeth catch the light, each one a tiny triangle of steel, each one capable of biting through bone if enough force is applied. There are clamps and forceps, dozens of them in various sizes. Some are delicate, meant for pinching skin together. Others are heavy, meant for crushing blood vessels closed. They have long handles for leverage, and the jaws are textured with cross-hatching to provide grip. You imagine these tools biting into flesh, holding an artery closed while the barber-surgeon works, and you feel a coldness in your stomach. There are hooks, curved metal hooks with sharp points, and you cannot imagine what these are for until you realize they are meant to pull tissue aside, to hold open a wound so that the surgeon can see what he is doing. The thought makes you dizzy. There are needles, large and curved like fishing hooks, threaded with what looks like catgut or silk. These are for sewing, for stitching wounds closed after the cutting is done. The needles are not sterile. Nothing here is sterile. But they are clean, and in the medieval world, clean is the best anyone can hope for. And there, at the far end of the table, is a small brass brazier, and inside the brazier, glowing red-hot, are cauterizing irons. These are not for cutting. These are for burning, for searing flesh closed when stitching is not enough, when the bleeding will not stop, when heat is the only thing that can seal a wound. The smell of hot metal fills that corner of the room, mixing with the herb smells and the vinegar smell, and creating something acrid and unpleasant. The coldness of the steel is what strikes you most, not the sharpness, although that is evident, not the purpose, although that is clear, but the temperature. Metal holds cold like nothing else, and these tools have been sitting on this table in this cool room, and if they were to touch your skin right now, they would feel like ice. Later, if they are used, they will warm to body temperature, will become slick with blood, will lose that initial shocking coldness. But for now, in this moment before anything has begun, they are cold and clean and waiting. The barber-surgeon notices your gaze and allows himself a small smile. He understands the fear. He has seen it 1,000 times. He gestures to the chair again, more insistently this time, and you realize that whatever happens next will happen whether you are ready or not. But first, before any surgery, before any bloodletting, before any of the procedures that you came here for, there is something mundane that must occur. Something so ordinary that it feels almost absurd given the setting. You need a shave. Your beard has grown thick over the past weeks, and the barber-surgeon has suggested that you start with this, with something simple, with something that will help you understand his skill before trusting him with anything more serious. You sit in the chair and it creaks beneath your weight. The wood is smooth from use, worn down by countless bodies. The barber-surgeon drapes a cloth around your shoulders, tucking it in at your neck. His hands are warm despite the coolness of the room, and his touch is gentle, professional, efficient. He is practiced at this. He has done this 10,000 times. He turns to a small table beside the chair and begins to prepare. There is a ceramic bowl, and into this bowl he pours hot water from a kettle that has been sitting near the brazier. Steam rises, carrying the scent of minerals and metal. He adds a chunk of soap, something made from lye and animal fat, and begins to work it with a brush. The brush is made of boar bristles, stiff and slightly scratchy, and he works it in circles until the soap forms a thick lather, white and dense, and smelling faintly of lavender. He applies this lather to your face with long, methodical strokes. The brush moves from your cheeks to your jaw, from your neck to your chin, covering every inch of skin that needs to be shaved. The sensation is pleasant, soothing, almost hypnotic. The warmth of the water, the softness of the lather, the rhythmic movement of the brush. This is the part of the barber-surgeon's job that everyone can enjoy, the part that involves no pain, no blood, no fear. Then he picks up the razor. It is a straight razor, of course. The folding safety razor will not be invented for another 500 years. This is a single piece of steel, honed to an edge so fine that you cannot see it, only sense it, only know that it is there by the way the light slides along its length. The handle is made of horn, polished and smooth, and the blade itself is perhaps 3 inches long. It looks like a weapon. In other hands, it would be a weapon. He tests the edge on his thumb, lightly, barely touching, and you see him nod in satisfaction. The blade is ready. He positions himself beside you, his body angled, his hand steady. He places the blade against your cheek, and the first thing you feel is the coldness. The metal is cold, so cold, and it presses against your skin with a firmness that suggests absolute confidence. Then he pulls. The razor moves down your cheek in a long, smooth stroke, and you feel the whiskers being cut, feel the slight tug as each hair is severed at the base. The sound is distinctive, a soft scraping that seems too loud in the quiet room. The blade moves through the lather, leaving a clean path of skin behind, and the barber-surgeon wipes the lather and cut hair onto a towel draped over his shoulder. He works methodically, section by section, stroke by stroke, from your cheeks to your jawline, from your jawline to your neck. Each movement is precise, controlled, the result of years of practice. The blade never cuts you, never even threatens to cut you. His hand is that steady, his skill that complete. And yet you are aware of the danger. The blade is against your throat now, moving along the sensitive skin beneath your jaw, and you know that a single slip, a single moment of inattention could open your jugular vein. You would bleed out in minutes. But the barber-surgeon does not slip. His hand remains steady. His breathing is slow and regular. This is just another shave, another face, another morning in a long career of mornings. He pauses to wipe the blade clean, and you watch as the lather mixed with cut hairs falls onto the towel. There is something almost meditative about the process, something calming in its routine. Outside, the medieval world continues its chaos. But here, in this moment, there is only the razor and the skill and the slow, careful revelation of clean skin. When he finishes, he takes a hot towel from the kettle, wrings it out with practiced efficiency, and presses it against your face. The heat is almost too much, almost painful, but then it settles into something deeply pleasurable. Your pores open. Your muscles relax. The tension you did not know you were carrying begins to ease. He removes the towel and applies a salve, something made from herbs and animal fat, something that smells of mint and something sharper, something medicinal. Your skin feels cool where the salve touches, and you realize that this is alcohol of some kind, a tincture meant to prevent infection, meant to soothe the skin. You stand from the chair and you touch your face. It is smooth, cleaner than it has been in weeks. The barber-surgeon nods, satisfied with his work. But both of you know that this was just the beginning, just a demonstration of skill, just a way of building trust. Because now comes the real work. Now comes the bloodletting. The theory is simple, elegant, and completely wrong. But you do not know it is wrong because you live in a world where the four humors govern all medical understanding. The human body, you have been taught, contains four vital fluids: blood, which is hot and wet; phlegm, which is cold and wet; yellow bile, which is hot and dry; and black bile, which is cold and dry. Health is the balance of these humors. Illness is the imbalance. And the cure for almost any imbalance, according to the learned physicians of your time, is to remove excess blood. You have been feeling unwell for weeks, headaches that pound behind your eyes, a fever that comes and goes, a general sense of weakness and malaise. The barber-surgeon has listened to your complaints, has examined your tongue and your eyes and the color of your urine, and has pronounced his diagnosis. You have too much blood. Your sanguine humor is in excess. The treatment is obvious. You sit in the chair again, and this time the atmosphere is different. This time there is a seriousness, a gravity that was absent during the shave. The barber-surgeon is preparing his tools, and you watch as he selects a lancet from the table. It is a small blade, triangular in cross-section, with a sharp point and two cutting edges. It looks delicate, almost decorative, but you know that it is designed for one purpose only: to open veins. He ties a strip of cloth around your upper arm, pulling it tight, and you feel the pressure as the blood flow is restricted. Your veins begin to swell, becoming more visible beneath your skin. He probes with his fingers, pressing gently, feeling for the right spot. He is looking for the median cubital vein, the large vessel that runs through the crook of your elbow. This is the easiest vein to access, the safest, the most predictable. He finds it. You feel his finger press down, marking the spot, and then he picks up the lancet. He holds it like a pen, delicate and controlled, and he positions the point against your skin. You feel the pressure, a small indentation, and then there is a sharp, brief pain as the blade pierces your skin and enters the vein. The pain is not as bad as you expected. It is quick, like a bee sting, and then it fades to a dull ache. But what you feel next is stranger, more unsettling. You feel the blood leaving your body. It is a sensation of warmth and flow, of something vital being pulled away. The blood runs down your arm in a thin stream, and the barber-surgeon positions a ceramic bowl beneath to catch it. The blood is darker than you imagined it would be. Not the bright red of an arterial cut, but a deep, almost purple red. Venous blood, rich with waste products, carrying the excess humors away from your body. The barber-surgeon watches it carefully, monitoring the flow, judging the amount. He has done this so many times that he can estimate volume by sight, can tell when enough has been let. The blood drips into the bowl with a rhythmic sound. Drip, drip, drip. Each drop is distinct, percussive, marking time. You watch the bowl begin to fill, watch the blood pool at the bottom and then slowly rise. The color in the bowl seems to deepen as more is added, seems to become richer, thicker. There is something hypnotic about watching it, something that pulls at your attention and holds it. The room is quiet except for the dripping blood and the soft chirping of the finch in its cage. Time seems to stretch, seems to slow. You can feel your heartbeat in your arm, can feel each pulse pushing more blood out through the cut. The sensation is rhythmic, regular, steady as a drum. The barber-surgeon is watching you as carefully as he watches the bowl. He is looking for signs of distress, for the moment when the bloodletting has gone far enough. Your skin is beginning to pale. Your breathing is becoming shallower. These are the signs he is looking for, the indicators that your body has given enough. Finally, after what feels like an eternity but is probably only 10 minutes, he loosens the tourniquet and presses a clean cloth against the cut. The blood flow slows immediately, and he holds the cloth in place with firm pressure. After a moment, he removes the cloth and examines the wound. The bleeding has stopped. He applies a small bandage, wrapping it around your arm with practiced efficiency. You feel lightheaded. Not faint, not quite, but definitely weaker than you were before. The barber-surgeon offers you a cup of wine, something to restore your strength, and you drink it gratefully. The wine is sour and thin, but it warms your stomach and seems to clear your head somewhat. The bowl of blood sits on the table, maybe a pint, maybe a little more. Later, the barber-surgeon will dispose of it, will pour it into the street or onto a dung heap. For now, it sits there as evidence of the procedure, as proof that the treatment has been administered. You stand slowly, carefully, and you realize that you feel different. Not better, not yet, but different. Lighter, perhaps, emptier. The headache is still there, throbbing behind your eyes, but you convince yourself that it is less severe, that the treatment is beginning to work. This is the power of belief, the placebo effect in action, though you do not have words for these concepts. But not everyone can afford bloodletting. Not everyone can pay for the barber-surgeon's time and skill. For the poor, for the peasants, for those who cannot spare even a few pennies, there is another option. There are the leeches. The day is grey and damp when you walk to the marsh at the edge of the city. The ground squelches beneath your feet, and the air is thick with the smell of standing water and rotting vegetation. This is where the leeches live, in the shallow pools and slow-moving streams, in the mud and the muck where the water barely moves. You have brought a small sack with you, and in this sack is a piece of raw meat, liver from a pig, dark and bloody. This is the bait. You wade into the water, feeling the coldness seep through your boots, feeling the mud suck at your feet. The water is murky, brown with suspended sediment, and you cannot see more than a few inches beneath the surface. You place the liver in the water and wait. It does not take long. Leeches are attracted to blood, to warmth, to the promise of a meal. Within minutes, you see them. Dark shapes moving through the water with an undulating motion, swimming with surprising speed and purpose. They are ribbon-like, perhaps 2 inches long, black or dark brown, segmented. They move toward the liver with single-minded determination. You reach into the water and pluck one out. It is cold, slippery, muscular. It writhes in your hand, seeking heat, seeking blood. Its body is covered in a thin layer of mucus that makes it difficult to hold. You can see its mouth, a circular opening with 3 jaws arranged in a triangular pattern. Each jaw is lined with tiny teeth, too small to see individually but effective in aggregate. You drop it into your sack and reach for another, and another. Within an hour, you have collected perhaps 20 leeches, all of them hungry, all of them eager to feed. You tie the sack closed and begin the walk back to the city. The next morning, you sit in the barber-surgeon's chair again, and this time he brings out the sack of leeches. He reaches in without hesitation and pulls one out, holding it between his thumb and forefinger. The leech is active, wriggling, searching. He places it on your arm, just below the elbow, and you feel it immediately. The coldness of its body against the warmth of your skin, the wetness of it, the slight tickling sensation as it begins to move, searching for the right spot to attach. Then it bites. The sensation is not painful, not exactly. The leech's saliva contains an anesthetic, a natural substance that numbs the skin as it cuts. What you feel is pressure, a pulling sensation, and then a strange, hollow feeling as the leech begins to feed. You can feel it drawing blood, feel it swelling, feel its body becoming larger and heavier as it fills. The barber-surgeon places another leech on your arm, and another. Soon there are 5 leeches attached, 5 dark shapes clinging to your skin, all of them feeding. They are hideous and fascinating in equal measure. You cannot look away. They feed slowly, methodically. A leech can take 30 minutes to an hour to reach satiety, and during that time, it will consume several times its own body weight in blood. You watch them swell, watch their segmented bodies expand, watch them transform from ribbons to sausages. The sensation of multiple leeches feeding is strange beyond description. There is the pulling, yes, but there is also a coldness that spreads from each attachment point, and beneath that, a slight burning sensation that might be your imagination or might be real. The leeches secrete an anticoagulant called hirudin, which prevents your blood from clotting while they feed, and this substance causes a mild inflammatory response. Finally, after what seems like hours, the first leech detaches. It simply lets go and falls onto the cloth that the barber-surgeon has spread beneath your arm. It is swollen now, grotesquely enlarged, barely recognizable as the same creature that attached earlier. The barber-surgeon picks it up and drops it into a jar of water, where it will slowly digest its meal over the coming weeks. One by one, the other leeches detach and are collected. Your arm is covered in small wounds, circular marks where the leeches bit. These wounds ooze blood steadily because of the anticoagulant, and the barber-surgeon presses clean cloths against them to stop the bleeding. It takes several minutes for the blood to finally clot. You feel weak again, drained, but also strangely satisfied. The treatment has been administered. The excess blood has been removed. According to the medical wisdom of your time, you should begin to feel better soon. But there is one more procedure to discuss, one more experience that nearly everyone in the medieval world will endure at some point in their lives: the tooth extraction. The pain starts as a dull ache in your back molar, barely noticeable at first, easy to ignore. But pain has a way of growing, of demanding attention, of becoming impossible to ignore. Within days, the ache has transformed into something sharper, something that pulses with each heartbeat. Within a week, it is agony. You cannot eat on that side of your mouth. You cannot sleep. The pain radiates from the tooth up into your jaw, into your cheek, into your skull. It is constant, unrelenting, maddening. You return to the barber-surgeon, and when you open your mouth to show him the problem, he shakes his head grimly. The tooth is rotten, decayed, dark with necrosis. The gum around it is swollen and red, infected. There is pus visible at the gum line, a yellow-white discharge that tastes foul in your mouth. The tooth must come out. There is no other option. He reaches for a tool on his table, and when you see it, your blood runs cold. It is called a dental pelican, named for its resemblance to a pelican's beak. It is a metal instrument, perhaps 6 inches long, with a claw on one end and a fulcrum on the other. The claw is designed to grip the tooth. The fulcrum is designed to rest against your jaw, and the leverage between them is designed to rip the tooth from its socket with brute force. The barber-surgeon does not offer you anything for the pain. There is no anesthesia, no numbing agent that would work quickly enough or effectively enough. The best he can offer is a leather strap for you to bite down on with your other teeth. something to help you channel the pain, to give you something to focus on besides the agony. He positions the pelican in your mouth, and you feel the cold metal against your gums, against your tongue. He adjusts it carefully, making sure the claw is firmly gripping the rotten tooth. You can feel the pressure as he tightens his grip, can feel the tooth beginning to shift in its socket. Then he pulls. The pain is indescribable. It is white-hot, searing, absolute. It feels like your entire jaw is being torn away. You hear a cracking sound, impassably loud inside your skull as the roots of the tooth break free from the bone. You taste blood, sudden and copper-sharp, flooding your mouth. And then, suddenly, it is over. The barber-surgeon holds up the tooth, triumphant. It is a hideous thing, brown and black, the roots jagged where they snapped, clinging to fragments of bone. But it is out. The source of the pain is gone. Your mouth is filling with blood, and the barber-surgeon hands you a cloth to bite down on. The socket where the tooth was is a raw, bleeding crater, and the pain is still immense, but it is different now. It is the clean pain of injury rather than the festering pain of infection. It will heal. Given time, it will heal. You sit in the chair, breathing heavily, trembling from the adrenaline and the shock. The finch continues to chirp in its cage. The candles continue to flicker. Outside, the medieval world continues, oblivious to your suffering. This is surgery in the medieval world. This is medicine before anesthesia, before antibiotics, before any understanding of germs or infection or the true workings of the human body. This is a world where pain is expected, where suffering is routine, where survival depends more on luck than skill. And yet the barber-surgeon cleans his tools carefully. He wipes them with vinegar, scrubs them with sand, stores them in their proper places. He does not know why cleanliness matters, but he knows that it does. He has seen enough infections, enough deaths, to understand that something about the clean tools leads to better outcomes. The light from the candles grows softer as the afternoon wears on. The shop begins to cool as the brazier burns low. Soon, another patient will arrive, another person seeking relief from pain, seeking healing, seeking hope. And the barber-surgeon will be ready, his tools sharp, his hands steady, his confidence unshakable. This is the world of medieval surgery. Sharp, metallic, painful, and yet somehow, inexplicably, it works often enough to keep people coming back, keep them believing, keep them trusting in the skill of a man who cuts both hair and flesh with the same sure hand. The worst cases come in the morning. They arrive on carts, or supported between friends, or sometimes carried on makeshift stretchers. These are the patients with infections that have spread beyond control, with limbs that have turned black and gangrenous, with wounds that smell of death. These are the patients who need amputation. You are standing in the shop on a cold October morning when they bring him in. He is a laborer, perhaps 40 years old, though it is hard to tell because pain has aged him. 3 days ago, a cart wheel rolled over his lower leg, crushing the bones between ankle and knee. The barber-surgeon was called immediately, and he set the bones as best he could, splinted the leg with wooden slats and linen wrappings, and sent the man home to heal. But the leg did not heal. Instead, it began to rot. You can smell it before you see it. The smell of gangrene is unlike anything else, sweet and putrid at the same time, the smell of living tissue turning to dead meat. When the barber-surgeon unwraps the bandages, the extent of the damage is obvious. The skin below the knee has turned dark purple, almost black. There are blisters filled with foul-smelling fluid. The flesh is soft, almost liquefied in places. And worst of all, there is no feeling. When the barber-surgeon presses his finger against the blackened skin, the man does not react. The nerves are dead. The diagnosis is simple and final. The leg must come off. If it stays, the rot will spread upward, will consume the whole body, will kill the patient within days. The only chance for survival is amputation, and it must be done now, today, this morning, before the infection reaches the thigh. 4 strong men are called in from the street. They are paid a few pennies each for their work, and their job is simple but crucial. They must hold the patient down. The man is positioned on a heavy wooden table, his back flat, his arms pinned to his sides. The 4 assistants take their positions, 2 at his shoulders, 2 at his hips. Their grips are firm, prepared for the struggle they know is coming. The barber-surgeon selects his tools with care. First, a tourniquet, a leather strap 3 inches wide. This will be tied around the thigh, high above the point of amputation, tight enough to cut off blood flow completely. Without this tourniquet, the patient will bleed to death in seconds when the major vessels are severed. The barber-surgeon wraps it around the thigh and pulls, using all his strength, twisting a wooden rod to tighten it further. The man cries out as the circulation is cut off, as his leg begins to go numb from lack of blood. Next, the knife, a heavy blade, curved slightly, sharp enough to slice through skin and muscle with a single stroke. The barber-surgeon tests the edge one final time, drawing it carefully across his thumbnail. He nods, satisfied. And then comes the saw. This is a specialized tool, not the same as the carpentry saw you might use to cut timber. The blade is narrower, the teeth finer, designed specifically for cutting through human bone. It has 2 handles, one at each end, allowing for a smooth back and forth motion. The metal is clean, gleaming in the morning light that streams through the window. The barber-surgeon positions himself at the table. He measures carefully, feeling along the leg with his fingers, finding the point where healthy tissue meets diseased tissue. The amputation must be made well above the infection, in tissue that still has blood flow, tissue that can heal. He settles on a spot about 4 inches below the knee, in the upper calf. He looks at the patient, and their eyes meet. There is understanding there, a grim acceptance. The man knows what is about to happen. He knows it will be the worst pain of his life, but he also knows it is his only chance at survival. The barber-surgeon gives the signal, and the assistants tighten their grips. Then, with one swift motion, he makes the first cut. The knife slices through the skin in a circular motion, going completely around the leg. The patient screams, a sound of pure animal agony that fills the shop and spills out into the street. The assistants lean their weight on him, holding him still as he thrashes. Blood wells up from the cut, but not as much as you would expect because of the tourniquet. The barber-surgeon works quickly now, speed being essential. He cuts deeper, through the layer of fat beneath the skin, through the muscle tissue. He cuts down to the bone, creating a cuff of flesh that can be pulled back. The muscles are surprisingly tough, fibrous, resistant to the blade. He has to saw at them in places, his arm moving in rapid strokes. Then he takes a second knife and carefully separates the muscle from the bone, scraping it away, pulling it upward to expose the tibia and fibula. The bone is white, stark against the red meat of the muscle. This is the moment of truth. He picks up the saw. The sound is what you remember later, what haunts you in quiet moments. The sound of steel teeth biting into bone, a rhythmic grating, scraping noise that seems impossibly loud. The saw moves back and forth, each stroke cutting a little deeper. The bone resists, being much harder than any soft tissue, and the barber-surgeon has to use considerable force. His arm pumps steadily, his breathing becomes labored. Sawdust, except it is not sawdust, but bone dust, begins to fall onto the table in a fine white powder. The patient has gone beyond screaming now. He is making sounds that are barely human, a keening wail that rises and falls with each stroke of the saw. His body is rigid with pain, every muscle locked tight. The assistants are struggling to hold him, their faces twisted with effort and sympathy. The saw cuts through the first bone, the tibia, and the sound changes slightly. The barber-surgeon adjusts his angle and begins on the fibula, the thinner bone that runs alongside. This goes faster, and suddenly, with a final grinding crunch, the saw breaks through. The lower leg is severed completely. An assistant takes the amputated limb and carries it away, and you try not to look at it. Try not to see the foot still wearing its leather shoe. Try not to think about the fact that this piece of a person is now just meat, just waste to be disposed of. But the surgery is not over. The stump is bleeding, even with the tourniquet in place. Small vessels, capillaries, are oozing blood. The barber-surgeon works quickly, pulling the muscle tissue down over the exposed bone, creating a flap that will eventually heal over. He ties off the major blood vessels with silk thread, his fingers working with practiced precision despite the blood that makes everything slippery. And then comes the part that makes even hardened observers turn away: the cauterization. The cauterizing iron has been heating in the brazier throughout the procedure, and now it glows red-hot, almost white at the tip. The barber-surgeon lifts it carefully, and you can feel the heat radiating from it even from several feet away. He moves it toward the stump, and when it touches the raw flesh, there is a hissing sound, and smoke rises, and the smell of burning meat fills the room. The patient, who you thought could not possibly scream any louder, finds new depths of agony. The assistants have to use all their strength to hold him down as the hot iron sears the tissue, cauterizing blood vessels, sealing the wound with heat. The barber-surgeon works systematically, touching the iron to every part of the stump that is bleeding, holding it there for a few seconds each time, making sure the tissue is thoroughly burned. Finally, mercifully, it is done. The stump is sealed, charred black in places, but no longer bleeding. The barber-surgeon releases the tourniquet, and blood flows back into the upper leg. He watches carefully for signs of renewed bleeding, but the cauterization is held. He applies a thick paste made of honey and herbs, something to prevent infection, and then begins to wrap the stump in clean linen bandages. The entire procedure has taken perhaps 90 seconds from the first cut to the final cauterization. Speed is essential in amputation. The longer it takes, the more blood is lost, the greater the shock to the patient's system, the lower the chance of survival. A skilled barber-surgeon can complete an amputation in under 2 minutes, and this speed, as brutal as it seems, is what keeps patients alive. The man on the table has stopped screaming. He lies still now, his chest heaving, his face pale as milk, his body drenched in sweat. He is in shock, hovering on the edge of consciousness. The barber-surgeon gives him wine mixed with something else, some herb that will dull the pain and help him sleep. Within minutes, the man's eyes close, and his breathing becomes deeper, more regular. He will be carried home on the same cart that brought him. Over the next weeks, he will either heal or he will die. The odds are roughly even. If infection sets in, if the wound does not close properly, if blood poisoning develops, he will be dead within days. But if his body can fight off the infection, if the stump heals clean, if luck is on his side, he will live. He will learn to walk with a wooden peg, will learn to work again, will survive in a world that has little sympathy for the disabled. This is the reality of amputation in the medieval world. Fast, brutal, agonizing, and yet sometimes successful. But there are procedures even more delicate than amputation, procedures that require a steadier hand and nerves of steel. There is trepanation, the drilling of holes in the human skull. The man who sits in the barber-surgeon's chair this afternoon is different from the laborer with the gangrenous leg. He is wealthy, or at least comfortable, judging by his clothing and the gold ring on his finger. He has been suffering from headaches for months, terrible headaches that make him sensitive to light and sound, that sometimes cause him to vomit, that occasionally bring on fits where he loses consciousness and his body convulses. A university-trained physician has examined him, has consulted ancient texts, and has pronounced that there is pressure inside his skull, or perhaps demons, or perhaps both. The treatment, according to these learned texts, is trepanation. A hole must be drilled into the skull to let the pressure out, to give the demons an escape route, to restore balance to the humors. The patient is understandably terrified. The barber-surgeon talks to him in a low, calm voice, explaining the procedure, showing him the tools. There is some comfort in understanding, in knowing what to expect, even if what you expect is pain. The man is positioned in the chair, and his head is shaved completely. The barber-surgeon works slowly, methodically, removing every trace of hair from the skull. When he is finished, he examines the scalp carefully, feeling with his fingertips, looking for the right spot. He settles on a location just above the left ear in the temporal bone, where the skull is relatively thin. He makes a small incision in the scalp, a straight cut about 2 inches long. Blood wells up immediately, and he uses a cloth to keep the wound clear. Then he pulls the scalp aside with small metal hooks, exposing the white bone of the skull beneath. The tool he reaches for is called a trepan, and it looks like a cross between a drill and a corkscrew. It has a wooden handle that fits comfortably in the palm and a metal shaft that ends in a circular bit. The bit has sharp teeth arranged in a ring designed to cut through bone when rotated. The barber-surgeon positions the trepan against the exposed skull and begins to turn. The motion is slow, controlled, the same motion you might use with a large auger when drilling into timber. But this is not timber. This is living bone, and beneath it, separated by only a thin membrane, is the brain itself. The sound of the trepan cutting into bone is strangely delicate, a grinding, crunching sound that is quieter than the bone saw used in amputation. The barber-surgeon pauses frequently, clearing away the bone dust that accumulates in the cut, checking his progress. He must be careful not to drill too deep, not to penetrate the dura mater, the membrane that protects the brain. If he punctures that membrane, if he touches the brain tissue itself, the patient will almost certainly die. The patient sits rigid in the chair, his hands gripping the armrests so tightly that his knuckles are white. His eyes are wide with fear, but he remains still, understanding that any sudden movement could be fatal. The pain is intense but bearable, a deep aching pressure rather than sharp agony. The skull, surprisingly, has fewer nerve endings than other parts of the body. The barber-surgeon continues to drill, the circular bit cutting deeper and deeper into the bone. You can see the white bone dust accumulating, can see the growing groove that marks his progress. He works patiently, never rushing, never applying too much pressure. This is surgery that requires absolute precision. After perhaps 20 minutes, the trepan breaks through. The barber-surgeon feels it immediately, a sudden lack of resistance, and he stops turning. He removes the trepan carefully and peers into the hole he has created. It is perhaps half an inch in diameter, perfectly circular, with smooth edges. Through the hole, you can see the grayish-pink membrane of the dura mater pulsing slightly with each heartbeat. The barber-surgeon seems satisfied. The pressure has been relieved, the demons have their escape route, the balance has been restored. He does not attempt to close the hole in the skull. It will remain open, covered only by the scalp. Over time, scar tissue will form, and the patient will live the rest of his life with this small window into his brain. He stitches the scalp back together with careful, even stitches, using a curved needle and silk thread. He applies a bandage and instructs the patient to keep it clean and dry. The patient is told to rest for several weeks to avoid any activity that might cause a blow to the head. Remarkably, many patients survive trepanation. The survival rate is surprisingly high, perhaps as much as 70%. Some patients even report that their symptoms improve, though whether this is due to the surgery itself or to the placebo effect is impossible to say. The human body is resilient, and the brain, despite its delicacy, is protected by multiple layers of defense. But not all surgery happens in the calm, controlled environment of the barber-surgeon's shop. Some surgery happens on battlefields, in muddy fields, in the chaos and screaming of war. You are standing in a tent behind the battle lines, and the ground beneath your feet is sticky with blood. The tent is full of wounded men, and the air is thick with the sounds of their suffering. Groans and cries and prayers and curses all blend together into a symphony of pain. The barber-surgeon moves among them, triaging, deciding who can be saved and who cannot, deciding who will be treated first. There is a knight on a rough wooden table, his armor already removed by his squire. An arrow protrudes from his shoulder, and from the angle of entry, it is clear that the arrowhead is buried deep in the muscle, possibly touching bone. The shaft of the arrow has been broken off short, probably during the battle, leaving only a few inches of wood sticking out of the wound. The barber-surgeon examines the wound carefully. Simply pulling the arrow out is not an option. Medieval arrows have barbed heads designed to catch in flesh, and pulling them out would cause even more damage than pushing them in. Instead, the arrowhead must be extracted carefully, surgically. He reaches for a specialized tool called an arrow spoon. It looks like a small ladle made of metal, with a long handle and a curved, spoon-shaped end. The spoon part has a split down the middle, forming two prongs. This tool is designed to be inserted into the wound alongside the arrow shaft, to scoop around the arrowhead, and to pull it out while keeping the barbs contained within the spoon. First, though, the arrow shaft must be removed completely. The barber-surgeon grips it firmly and pulls, and it comes away with a wet sucking sound, leaving just the arrowhead buried in the shoulder. Blood wells up from the wound, dark and steady. He takes the arrow spoon and begins to probe. The metal tool slides into the wound, following the track left by the arrow, pushing deeper into the tissue. The knight gasps and grinds his teeth, but he does not cry out. He is a soldier, trained to endure pain, and he knows that showing weakness in front of other men is unacceptable. The barber-surgeon works by feel, guiding the spoon around the buried arrowhead. It takes several attempts, several adjustments, before he feels the prongs slip around the metal. Then, slowly, carefully, he begins to pull. The resistance is enormous. The barbed arrowhead wants to stay buried, wants to dig deeper. But the spoon contains the barbs, keeps them from tearing new channels through the muscle, and gradually, incrementally, the arrowhead begins to move. With a final tug, it comes free. The barber-surgeon holds it up, showing it to the knight, and there is relief in both their faces. The arrowhead is intact, which means no fragments have been left behind. The wound can now be cleaned and dressed. He pours wine into the wound, strong wine that burns and helps to clean out any dirt or debris. Then he adds honey, thick golden honey, that he spreads liberally over the torn tissue. Honey has been used for wound treatment since ancient times, and though the medieval surgeons do not know why it works, they know that it does. The honey creates a barrier against infection, and its antibacterial properties, though unknown to them, help keep wounds clean. Finally, he stitches the wound closed and wraps it in clean linen. The knight will be carried from the battlefield, will rest in camp for a few days, and will likely survive if infection does not set in. His arm will be stiff for weeks, maybe forever, but he will live to fight again. There is another soldier nearby with a different sort of wound. This one has been slashed across the chest by a sword, a deep cut that has opened the skin and muscle, but by some miracle has not penetrated the ribcage. The barber-surgeon treats this wound similarly, washing it with wine, packing it with honey, stitching it closed with long, even stitches that pull the flesh together. Battlefield surgery is faster, rougher, less careful than surgery in the shop. There is no time for delicacy when dozens of men are bleeding. The goal is simple: stop the bleeding, prevent infection, move on to the next patient. Those who can be saved quickly are treated first. Those whose wounds are too severe are given wine or poppy tea and made as comfortable as possible while they die. But what about pain relief? Surely, you think, there must have been something, some potion or herb that could dull the agony of surgery. And there was, sort of. Medieval anesthesia existed, but it was unpredictable, weak, and sometimes more dangerous than the surgery itself. The most common recipe is called dwale, and the barber-surgeon keeps a small bottle of it in his shop, though he uses it rarely. Dwale is a mixture of bile, usually from a pig or a boar, combined with opium, hemlock, lettuce juice, and vinegar. Sometimes henbane is added, or mandrake root, or other herbs known for their soporific properties. The mixture is boiled down until it becomes thick and syrupy, dark brown, smelling foul. A patient who drinks dwale will become drowsy, confused, sometimes unconscious. The pain does not disappear entirely, but it becomes distant, muffled, like something happening to someone else. The problem is that the dose required to produce unconsciousness is very close to the dose that will stop breathing altogether. Too little, and the patient remains awake and in agony. Too much, and the patient never wakes up. Because of this danger, dwale is used sparingly and only for the most serious surgeries. Most barber surgeons prefer to work without it, relying on speed and the patient's own fortitude to get through the procedure. There is another method, slightly safer but still unreliable. A sponge is soaked in a mixture of wine, vinegar, and mandrake root, then allowed to dry. When needed, the sponge is moistened and held over the patient's nose and mouth. The patient breathes in the fumes, and the active compounds in the mandrake, principally scopolamine and hyoscyamin, are absorbed through the lungs. This produces a twilight state, a dreamy semi-consciousness where the patient remains somewhat aware but does not fully register the pain. Monks in monastery hospitals sometimes use this technique, having perfected the recipe over generations. But even in the best hands, the results are inconsistent. Some patients fall into a deep sleep, others remain wide awake, and occasionally the fumes are too strong and the patient stops breathing. The harsh reality is that most medieval surgery is performed without any anesthesia at all. Patients endure the full force of the pain, and their survival often depends on their ability to withstand the shock. Strong men sometimes die from the trauma of amputation, while frail old women sometimes survive because they slip into unconsciousness quickly and their bodies shut down the pain response. But before any surgery, before any bloodletting, before any treatment at all, there is diagnosis. And the primary diagnostic tool of the medieval physician is not examination, not palpation, not listening to the heart or lungs. It is uroscopy, the analysis of urine. You bring your sample in a glass flask, clear or slightly greenish, depending on what you could afford. The barber-surgeon holds it up to the light, turning it slowly, examining the color. He has a chart on the wall showing perhaps 20 different shades of urine, each associated with different ailments. Pale yellow means too much phlegm. Dark yellow indicates fever. Red suggests blood in the urine, possibly a kidney problem. Cloudy white might mean kidney stones or bladder infection. But color is only the beginning. The barber-surgeon brings the flask closer, examining the contents for sediment. Are there crystals at the bottom? This could indicate stones. Is there a white cloudiness? This might be pus. Are there strands or threads suspended in the liquid? The medieval physicians call these threads worms and believe they indicate serious illness. Next comes the smell. The barber-surgeon removes the stopper and brings the flask to his nose, inhaling carefully. A sweet smell might indicate diabetes, though they call it honey urine and do not understand the mechanism. A foul smell suggests infection. A fruity smell could mean starvation or extreme fasting. And then, incredibly, disgustingly, some barber-surgeons will taste the urine. Just a small amount on the tip of a finger touched to the tongue. Sweetness confirms diabetes. Bitterness might indicate bile problems. Saltiness is normal and healthy. This entire process is treated with utmost seriousness. The urine is examined in good light, compared to charts and books, discussed and pondered. The diagnosis that emerges from this analysis will determine the treatment, will decide whether the patient needs bloodletting or leeches or herbal remedies or surgery. Of course, uroscopy is almost completely useless as a diagnostic tool. The charts are based on superstition and faulty theory. The interpretations are wildly inaccurate, but occasionally, by sheer chance, a correct diagnosis emerges, and this is enough to maintain faith in the system. What makes this situation even more complicated is the bitter rivalry that exists between two classes of medical practitioners. On one side are the physicians, university-educated men who have studied Galen and Hippocrates, who know Latin and Greek, who can quote ancient texts and debate medical theory for hours. On the other side are the surgeons, often illiterate or barely literate, trained through apprenticeship, men who work with their hands and learn by doing. The physicians look down on the surgeons. They consider surgery to be low work, manual labor, something beneath the dignity of a learned man. A physician will examine a patient, will study the urine, will make a diagnosis, and will prescribe a course of treatment. But he will not perform the treatment himself. He will not let blood or pull teeth or cut into flesh. That work is left to the surgeons. The surgeons, for their part, resent the physicians. They see them as armchair theorists who understand nothing about the practical realities of medicine. A physician can talk for an hour about the balance of humors, but it is the surgeon who must hold a man down while sawing through his leg. A physician can prescribe bloodletting, but it is the surgeon who must judge how much blood to let, who must know when to stop, who must deal with the consequences if something goes wrong. This divide creates a strange medical world where diagnosis and treatment are separated, where the person who understands the theory never touches the patient, and the person who touches the patient is considered an ignorant laborer. The system is dysfunctional, inefficient, and yet it persists throughout the medieval period. You watch this play out in the barber-surgeon's shop one afternoon when a physician arrives to consult on a difficult case. The physician is dressed in fine robes, carries an ornate walking stick, and speaks in long, elaborate sentences full of Latin phrases. He examines the patient from a distance, never touching, never getting close enough to smell the wound or feel the fever. He pronounces his diagnosis based on the color of the man's urine and the position of the stars at the time of his birth. The barber-surgeon listens politely, nods at the appropriate moments, and then proceeds to treat the patient based entirely on his own experience and judgment. He knows what works. He has seen hundreds of cases like this, but he cannot challenge the physician's authority, cannot point out the absurdity of diagnosing an infected wound by examining urine. The social hierarchy is too rigid, the class distinctions too firmly established. So the charade continues. The physician collects his fee and departs, satisfied that his learning has been useful, and the barber-surgeon continues his work, saving lives through practical skill while being treated as little better than a craftsman. But eventually, the long day comes to an end. The last patient has been treated, the last bandage applied, the last tooth pulled. The sun is setting, and the light in the shop is fading. It is time to clean up. The barber-surgeon begins with the floor. There is blood on the floorboards, splattered and pooled, and this must be cleaned. He fills a bucket with water and adds vinegar, then begins to scrub with a stiff brush. The motion is rhythmic, methodical, the same motion he has performed every evening for years. The water in the bucket turns pink, then red, then dark red as the blood dissolves. He empties the bucket into the street outside, where it flows into the gutter and joins the other filth that characterizes medieval urban life. Then he refills the bucket and scrubs again, working until the floor is as clean as he can make it. It will never be truly clean, never be sterile, because the concept of sterility does not exist yet. But it will be clean enough, clean by the standards of his time. Next, the tools. Each instrument must be cleaned, dried, and put away. He starts with the knives, washing each blade with vinegar, wiping it carefully with a cloth. Then he takes a leather strop, a long strip of leather stretched tight and nailed to the wall, and he sharpens each blade with long, smooth strokes. The motion is almost meditative, the soft whisper of steel against leather filling the quiet shop. The edge must be perfect for tomorrow's work. The saws are cleaned next, the teeth scrubbed carefully to remove any fragments of bone or tissue. The clamps and forceps are washed and dried. The needles are examined for bends or breaks and then stored in a small wooden box lined with fabric. The cauterizing irons are allowed to cool completely in the brazier, then removed and stored. The lancets used for bloodletting are washed and wrapped in cloth. Every tool has its place, and everything must be returned to its proper location. The linen cloths that were used during the day's surgeries are collected. Those that are too blood-stained are thrown away. Those that can be saved are added to a pile that will be washed tomorrow. The barber-surgeon maintains a steady supply of clean linen, understanding that cleanliness, even if he does not understand why, improves outcomes. The bottles and jars on the shelves are checked. Which tinctures are running low, which herbs need to be restocked. Mental notes are made, a list compiled in his head of things to purchase at the market tomorrow. Dried sage, more vinegar, silk thread for stitching, a new leather strap as the old one is becoming worn. He feeds the finch in its cage, giving it seeds and water, and the bird chirps happily, hopping from perch to perch. This small creature has watched countless surgeries, has witnessed unimaginable pain, and yet it continues to sing. There is something comforting in that, something that reminds him that life continues, that not everything is blood and pain and death. Finally, he removes his leather apron and hangs it on its hook. He washes his hands one last time, scrubbing them thoroughly, and then he allows himself to sit. The chair, the same chair that held patience all day, now holds him. He leans back, closes his eyes for a moment, and breathes. He thinks about the day's patients. The man who lost his leg, will he survive? The night with the arrow wound, will infection set in? The man who underwent trepanation, will the headache stop? These questions have no immediate answers. He can only wait, can only hope that his skill was sufficient, that luck will be on their side. But for now, the work is done. The shop is clean. The tools are ready for tomorrow. It is time to close. He walks to the window at the front of the shop and begins to pull the shutters closed. The wood is heavy and the hinges creak with age. Outside, the street is quieting. The merchants have closed their shops. The workers have returned to their homes. The city is settling into the darkness of a medieval night, a darkness that is absolute because there are no streetlights, no electric glow, only the occasional flicker of a candle in a window. He bars the door, slides the heavy iron bolt into place. The shop is secure. He takes one final look around, checking that everything is in order, that nothing has been forgotten. The candles are still burning, casting their warm light over the clean floor, the organized shelves, the gleaming tools. One by one, he extinguishes the candles. He pinches each flame between his wet fingers, and the light dies with a small hiss. The darkness grows with each candle he puts out, until only one remains. This final candle sits on the table where the surgery was performed, and its light seems especially bright now that it is alone. He stands there for a moment, watching the flame flicker and dance. Tomorrow will bring new patients, new challenges, new pain to manage, and new wounds to treat. Tomorrow the tools will be stained with blood again, and the shop will smell of fear and vinegar and herbs. Tomorrow he will once again be the barber-surgeon, the man who stands between his patients and death, armed with nothing but sharp steel and imperfect knowledge. But that is tomorrow. Tonight the work is finished, the shop is quiet, and somewhere in the city patients are sleeping, their bodies fighting to heal, their lives hanging in the balance. Some will survive, some will not. Such is the nature of medieval medicine. Such is the reality of surgery in an age before anesthesia, before antibiotics, before any true understanding of how the body works. And as the surgeon wipes the last blade clean and places it back in its velvet case, the candle flickers and dies out. The pain is gone, the shop is quiet, and the city sleeps. You are safe here. Sleep well.